ongoing pandemic certainly brought great attention to viral airborne diseases, we should never undermine the prevalence of bacterial airborne diseases like tuberculosis. Tuberculosis, or TB, originates from infection of the Mycobacterium tuberculosis, which is a rod-shaped bacteria known as the bacillus. It infects many parts of the body, most commonly the lungs, but also the brain, intestines, kidneys, or spine. Similar to COVID-19, tuberculosis is spread rapidly through airborne particles, such as through sneezing or coughing. In Issue 40's Pathoprofile, you learn about tuberculosis meningitis, which is characterized as an inflammation of the meninges caused by an inflammatory response in the brain. However, tuberculosis comes in many forms. So, what other types of tuberculosis infections exist?
We divide our approach to TB into pulmonary and non-pulmonary. So the most common is pulmonary, and I would say it's probably the least dangerous, though it's the most infectious. And then when we look at the non-pulmonary, TB can infect almost any part of the body. And so we have one form of TB called Miliary Tb, which means it kind of showers everywhere. And it gets that name from the fact that it's in the lungs, and it's seen as these little specks in the lungs, which look like millet seeds, but it can shower to every part of the body. And then there are other patients who get TB that just affects the brain with a TB meningitis, or just affects the bone. Those patients actually aren't contagious.
Possibly the most prevalent case of tuberculosis comes in its pulmonary form. One interesting feature is its variation from patient to patient, indubitably spurred by differences in host immune response interactions to bacterial infection. We all know that tuberculosis causes coughing, fever, and chest pain as the body's immune cells target infected tissue. However, the range of pulmonary malfunction from barely any effect to severe impairment and specific ventilatory defects all change on a case-by-case basis. Once Mycobacterium tuberculosis, or MBT in short, is detected in the alveoli of the lungs, the host's immune system responds by triggering granuloma formation, which is a highly organized structure of various types of immune cells, including macrophages, neutrophils, natural killer cells, and T and B cells. The granuloma surrounds MBT-infected alveoli, triggering cell death in the alveoli and nearby structures. The necrotic tissue softens and is eventually coughed out, forming a cavity in its place. Then, gas-filled spaces surrounded by a collagen capsule replace the spot with new, normal lung tissue. Recent studies have noted that the malfunction of even a handful of granuloma can dramatically impact disease pathogenesis. Pulmonary tuberculosis can be either patently benign or incredibly deadly.
You get pulmonary TB when you're exposed to somebody with TB in their lungs. So if you had no exposure, then you're not going to pick up TB. However, from an individual level, the risk factors are the extremes of age. So we say the very young are at high risk and the very old. Anybody who's immunocompromised is at increased risk for TB. And the biggest risk factor that we see now is HIV. So co-infection with HIV increases your risk of active TB by 20 to 30 times.
Most pulmonary tuberculosis patients receive a combination drug therapy to counteract drug resistance. Some of these drugs include isoniazid, rifampin, pyrazinamide, and either ethambutol or streptomycin. Many exposed to the Mycobacterium tuberculosis with stronger immune systems only develop an asymptomatic, intransmissible variant known as latent tuberculosis. Of course, your older relatives or immunocompromised acquaintances may not be so lucky, so adequate sanitation and safety precautions should always be considered when coming in contact with tuberculosis patients.